morning, and thank you for joining us for the Syntero Forever Dublin presentation on tips and tricks to navigate government agencies. My name is Beth Baker, and I'm the Older Adult Volunteer Coordinator for Syntero and the Aging in Place Navigator for the City of Dublin. I do wish to inform you that this presentation will be recorded and archived, so if you choose not to have your image recorded, please cancel the video option at the bottom left of your screen. Questions are welcome and encouraged, but we ask that you utilize the chat function so that the presentation may flow. In this wide world of internet connections, emails, and tweets, sometimes it's the connection with people that we really crave. Making a phone connection, or in these days of COVID-19, an in-person connection is so very valuable when sharing, coordinating care, and understanding options related to program offerings. Knowing who to call and how to reach them expeditiously is key when navigating government agencies. I am so pleased to welcome Marcia Strall, who is a partner with ElderLife Solutions. Over the past 40 years, Marcia has worked in the area of geriatrics in a variety of medical settings, including psychiatric, acute and subacute hospital rehabilitation, skilled nursing, home health, assisted living, and outpatient clinics. Marcia has worked for ElderLife Solutions as a professional geriatric care manager and a licensed OTA, and now as a partner. Marcia works with families and other professionals in determining appropriate, safe living environments and assists those with needed additional services. She is a board member of the Upper Arlington Commission on Aging and a volunteer for the Ohio Department of Insurance, OSHIP. Please welcome Marcia Strall presenting Tips and Tricks when Contacting Government Agencies. Marcia?
Thanks, Beth. It's nice to be here. I'm glad you asked. I hope that this is a good informational presentation for all of you. With it, I have a slideshow, obviously, and in that will be direct numbers to contact government agencies, and then we'll talk a little bit about different agencies, how to access information in the community, and the best ways to talk to those agencies, you know, when you're working with them. My headline is a little different from the headline that Beth had put out, but it's the same information, so don't worry about that. I'm happy to be here. I've been a geriatric care manager now for almost 14 years. ElderLife Solutions was the first geriatric care management company to start here in the Columbus area. We serve a 5-county area. There is no licensure for a care management entity. Usually you have a degree or a licensure in some other allied health field like OT, PT, nursing, social work. We are vetted members of the Aging Life Network, which is the national organization that oversees our work. And we are happy to be here. We assist clients, like she said, in their homes, in facilities, work with families who live out of town to kind of help navigate the medical rivers and twists and turns that might happen when people have those kind of issues as they age. And also to talk to people about what to expect, what things cost, that kind of thing. So that's what we kind of do in a nutshell. So let's get on to the presentation. So government agencies and community resources, where to find them. So it's local government, county governments, state, and federal. Some of the specifics entities that we'll be talking about kind of cover each of those bases. Qualifications to move in and access those are usually income-based, asset-based, or geographical. You know, you live in a certain part of town, you live in a certain county, you can access different community resources through, where you live, the levy funded programs, that type of thing. If it's federal, it's usually a federal program. We'll talk some about those types of programs as we move on. And also how to access and get the most out of when you make those calls. The cost for some of these services, some are free based on, your qualifications. Some are income based. We'll talk a little bit about that. And some are asset based. So money you have in the bank, our investments are assets. Income is what you get every month. And most of these entities look at those. So we can talk a little bit about that as we move on. So let's start with the Central Ohio area aging. And I've put up their number there. One of the things that I would encourage everyone to do is to contact that number and ask for the resource booklet. In this booklet, they put it out every year. There's a wealth of information for services and how to access them. The Central Ohio Agency on Aging here in Franklin County is kind of the gatekeeper for a lot of different pots of money, let's put it that way. It can be grant money that certain agencies are able to have access to. It can be federal funds. It can be, state funds and county levy program funds. So each of those programs kind of come out of a different hat. The Central Ohio Area Agency on Aging, they provide programs for people in the county in need. So it might be caregiving in the home. It could be chores that need to be done that people need help with. It could be access or grab bars or whatever it might be that they need help with. And they do that through a couple different programs. Passport is one of those programs. That's Medicaid in the community. And that's applied for through the Area Agency on Aging. But it also is looked at through Job and Family Services. You have to qualify. That's the state level. It's part of a Medicaid program. It's kind of like Medicaid in the community. Another aspect of Medicaid, of course, is assistance in a long-term care facility or possibly even a waiver for care in the home or for care in an assisted living. So there's a lot of different under that big umbrella of Medicaid, what comes out of it. But Passport is one of the agencies that are one of the support systems that can come through applications through the Central Ohio Agency on Aging. When you call for help, you can call for the free booklet, which I would encourage everyone to do because the detailed explanation for everything and other agencies that you can look to for help is in this book. Every county puts out these books. The Franklin County, like I said, through COAAA, it's this booklet. Delaware County has their own booklet, looks like this. It's set up a little differently. Source Point is their main office, but Delaware County has their own. Licking County, Knox County has their own as well. You can call and get these booklets through any county agency in the country. There's 88 counties in Ohio, and each one of them has their own booklet. So even the rural counties, a lot of the services that are provided in the community in the rural counties come through the hospital that's close by. But if you Google anywhere in the country, any county, and just put senior support services for whatever county in the nation, it will come up. Either it's an area agency on aging or it will come up through a hospital system. And there's a booklet. The booklets may not be as big as and informative as this because there aren't as many agencies to help out. But certainly it's a start, especially if you have a loved one in another state and maybe you get a call that, hey, I'm going to need caregiving in the home, or maybe I need Meals on Wheels and they live in a whole nother state. You can do it by county, Just put in the county and their zip code and it will come up. You can call them and they will send you a booklet that can help explain everything. And it's kind of a one-stop shop that you can get a lot of information. You don't have to call around so much because they're going to have a concise, compiled local information of the agencies that you can contact. The other thing is, if you're calling COAAA for someone for help, a lot of times a neighbor will say, oh, this lady needs help. She doesn't have much money. Can I make a referral? Yes, you can. But you also have to understand that the agency is not going to come out and service that client if they don't want it. A lot of older adults, hesitate to have people coming into their home. And if over the phone, the agency contacts them and said, we have this referral, we'd like to, come out or meet with you either by phone or in person to talk about what your needs might be. If they say, oh, I'm doing fine, I don't need any help, the agency can't pursue it any further. So you have to understand that if the person doesn't want the service, the agency will not pursue getting those services in place. And you might have to, if you feel it's an unsafe situation, obviously you can contact the older adult, the Franklin County older adult where you feel someone's unsafe. I'm drawing a blank in my head of which to contact there, but the Adult Protective Services, sorry, I knew it would come to me, to let them know that those services, there may be an issue with your neighbor or whoever it might be, and they can investigate. But again, they can only do so much. If the people take a look at it, and certainly Syntero, you can call them as well if you feel someone's unsafe in their home and it's an older adult. But the Central Ohio, their Agency on Aging is kind of the gatekeeper for older adult information. And I would strongly suggest, tapping into their resource guide to get that information. And that also gives you information on all the other government agencies that you can call. But just know that, like I said, that the person has to be willing to accept the help before anybody can help them at the agency. So talking to them ahead of time before, you make that call for them, just to remind them that, yes, if someone calls you from the agency, they're there to help you, and you're telling me you want the help. So I'm going to call them and ask them to call you, but don't tell them you don't need the help when in essence, you really do. So you kind of got to give them a heads up. And that's kind of a little trick. In our practice, we've had a lot of people, we refer a lot of people, but unfortunately, when they get that call, which is kind of out of the blind because they don't know exactly when it's coming. It's not like they're going to call at noon on Thursday. And a lot of times they confuse that call with, some of the solicitations they have, and they don't accept it. And it's unfortunate because then we have to start the process again if they so need it. So make sure that you give them a heads up that if someone identifies themselves from the agency, that yes, I'd like to talk to somebody and I do need some help. Franklin County Office on Aging and Senior Options also has a number, and they have a senior citizen information handbook and a resource guide for people under the age of 60. That's another you can tap into. And Senior Options also is the levy funded program through the county. And COAAA also kind of is the umbrella agency that kind of vets people for that program. Again, that person wants to say yes, needs to say yes, that they need the services. And Senior Options can be, since it's levy funded, they do ask you in regard to your finances. It could be free for them if they qualify. It could be on a sliding scale. It just depends on each individual case. And they are the ones that will determine the cost of those services. That could be, meals delivered. It could be someone to help out with chores. It could be someone to help out with caregiving in the home. They also have a great caregiver support system that if you are caring for someone in your home or in their home, even if you're not in there 24/7, but you're back and forth every day helping people out. They have a great caregiver handbook, and they also have support services and meetings that you can attend to learn more about how to be a good caregiver to people in their home. Not all of us were born to be caregivers. We're not nurses. We're just family members or neighbors that are helping out. And it's a great resource to tap into through the agency on how to do that appropriately. Some of the individual cities around town, the individual cities around the Columbus area also have their own resource directory. One of those is Upper Arlington has their own resource directory. You can access that directory through the Upper Arlington Commission on Aging. And they put that out every 2 years, and it's a pretty comprehensive, but it's more local. Westerville also has their own, and you can access that through their senior center. The Upper Arlington Commission on Aging works with a lot of individuals that live in that community, but it also kind of is branching out into the Grandview area and Clintonville. And they collaborate a lot of times for not only services, but also possibly transportation, especially in the future. There are plans for that. And I know that transportation for those older adults that don't drive is an issue in any community. And Dublin has done a lot through the Dublin Hub as far as getting the bus going to do pickups and for appointments and also shopping, which is a great feature for the Dublin community. But Arlington and those other communities are starting to do that as well. Westerville has done it for a while. Each suburban community pretty much has those services in place. Not all of them have the directories, but certainly Upper Arlington is one. And if you live close to Upper Arlington, it's worth calling that number to access that information. The next service I want to talk about is the Veteran Service. The Veteran Service Commission, I kept the number in there. It can assist with any veteran claim you have. A lot of veterans from, World War II, there's still those out there, the Korean War and Vietnam, are hesitant. They came out of the service, went to work, and never accessed any benefits through the VA. So people need to think as they get older that if they are a veteran and they have served, there is a possibility that they could access some benefits as they age that maybe they hadn't thought of in, why they were working and in their 40s, 50s, and 60s. Some of those are two of ones that are biggies is access to medication. Medicare, you have to have a Medicare sanctioned Part D plan, and we'll talk a little bit about that later for drugs. But Medicare does recognize the VA, if you get your drugs through the VA, as credible coverage, and you won't be in a penalty situation because you didn't tap into and pay for. There is a premium involved in a Part D plan. What it can do through the VA, you can access their plan, call them and try and get in. You do have to go out to the VA clinic that's out near the airport. Should be seen by a doctor at least once there, so they get you registered, get you onto their records. But after that, you can access, even through the mail, medication through the mail, and sometimes it's cheaper. Now, not all medications are provided through the VA, but most of them are. And if you have any questions about that, I did even put the pharmacy number down there through the VA patient clinic. You can call and get information, even to see if it's worth your while to sign up for them. And it is depending on, it can save you that Part D premium if you're accessing it through Medicare. The other program that might help veterans and even widows of veterans is the Aid and Assistance Program. That program can provide monies monthly to help pay for care. It could be care in the home, a caregiver coming into the home and helping that veteran, or in an assisted living. Sometimes assisted livings or care in the home, the veteran has a set income amount coming in, and maybe their care is costing more than their income, or because of their, bills that they have at home or the cost of the assisted living, they can't quite meet that threshold. So this program has been put in place through the VA so that they can access dollar amounts that monthly that can help pay for those services, either in the home or in an assisted living. The application process it's the VA. So there are some paperwork to fill out. You would need to have your DD-14, which is your discharge papers. If you can't find them or don't have them, again, that Veterans Service Commission number is the one to call. They can access your records through your Social Security number and tell you if you qualify for this program. Let's say you're using a caregiver coming in and you apply at the beginning of December because you started in November and you're having trouble paying for the amount of care you need. And maybe you don't, and you make your application in December. Maybe you don't hear until after the first of the year, but as long as you're approved, it'll be retroactive to when you applied. So don't be afraid to apply because you think it might take too long. They go by the date of application. And if the application is too complicated or someone doesn't drive and can't go to the VA to do this, they sometimes do send out, I'm not sure if they're doing it now after COVID, but I believe that they are. They'll either do it virtually over the phone or come out to your home and help you make the application right in your home. And it's usually a counselor that helps you sign it, do all the paperwork. And then they also send a veteran along with that person. You can, if you're a widow of a veteran, if the veteran has passed away and his wife, as long as you've been married 10 years, that widow can also access some monies for the same types of services. So be aware that that program exists, and it can be very helpful. It can maybe be the difference between keeping you in your home with care or keeping you in an assisted living without having to move on to a long-term care facility. And most people want to stay in their homes. And as a veteran, I would encourage all veterans to access that if they feel the need and they may qualify. They do look at income, they do look at assets. Right now, I believe, don't quote me on this, it's $82,000. If you have $82,600 in assets, you have to be under that threshold in assets. It doesn't matter how much you get, your income, but as far as assets, they are looking at that. But even if you are over that, just remember that once you spend down those assets for paying for care, you can access that program.
Marcia, we have one comment. Yeah. Okay.
Well, I can't see it. I can't see the comment. Can you tell me what it says?
I believe veterans in skilled nursing facilities can also receive funds in addition to those in assisted living. So whether you're in skilled nursing or assisted living, you can still receive your funds.
You can, but I can tell you that if you're in assisted living and you are going to apply, the VA will tell you to apply for Medicaid rather than access there. That's why I didn't mention it. If you're already receiving those funds, yes, and you go into skilled care, those funds can continue, but typically they will tell you to pull those funds. They will pull those funds back once the person applies for Medicaid in the long-term care.
Thank you.
And then also, I should mention that the VA also provides support services for people that is diagnosis based. So diabetes, Parkinson's, cancer clinics, they have separate clinics for a lot of diagnosis based, folks, and they provide support services. It could be just meeting for support. It could be equipment. It just depends on what it is and what your needs are. So I included the number for the social worker general call at the VA. It's worth a call if you need, some equipment and you have a specific diagnosis and want to get into their clinic. It doesn't always mean that you need to get your medical care from the VA. Definitely, in order to do any of this with the VA, you will have to be assigned to a team doctor. However, it could be a one and done. It doesn't mean that you can't keep your doctor in the community. It's just an extra layer of medical support. So don't be afraid, even if it's something small that, hey, my dad's got cancer. He really could use some equipment. We don't, his insurance won't pay for it, but he is a veteran. You need to call them and find out if they might be eligible for some help there. So don't forget about the VA for all of this. If the individual, your mom or your dad or whoever, yourself, is a veteran, and even if the vet has passed away, his widow or her widower would be eligible for some of these services as well. So the Franklin County Office on Aging also has handbooks for people under 60. I think I mentioned it. They put out a senior housing guide, but even the senior housing guides in the community that you get at the grocery store, it's not a bad thing. It's pretty comprehensive. Now, mind you, not everyone is in here, but it's kind of a good starter if you're looking to change your residence. It can kind of give you an idea of what's around you. The folks pay to be in these booklets that are at the grocery store. So not everybody's in there for sure, but it's a good start to know what's available and maybe what questions to ask when you call an apartment building that may be 55 and older or 65 and older, or if it's a subsidized apartment. It can help you with those questions maybe. And even if you're not doing that now or don't have any plans in the near future, at least you can get educated on what's around and, and it's free. Like I said, they also have older adult resource guides as well. I mentioned that there are 88 counties in Ohio. All of them have resource guides, even if they're 3 pages long. I know my mother, when she was ill, lived up in a northern Ohio rural county, and most of the services came through the hospital. But it was good to know, even for me, who knows a lot about services here, I don't know about services in other counties and all of them if we don't service them. So yes, actually, it's good to get that information because some of the hospital services can operate a little differently. So it's good to have that information even before the crisis. So if you have a loved one in another town, another county, no matter what state it's in, it's a great idea. If you're the first call they're going to make, go ahead and get that booklet now so that you've got something in hand when the time comes before the crisis happens. And like I talked about, the local resource guides for the Upper Arlington Community Commission on Aging has their booklet, the Westerville Senior. Another one is the Clintonville Beachwald Community Resource Center. They do a lot with the people toward, that area of town, more toward downtown. I put their number in because they provide a lot of services at their center as well. You can get information on congregate meals, whatever it might be. They do food bank information as well. It's just a great resource center, and they provide transportation through their resource center as well. So another program I want to talk about in the community is OSHIP, and this one's kind of near and dear to my heart. I've been an OSHIP volunteer for about 15 years, and it's a federally funded program. This one is federal, and it's the Ohio Senior Health Insurance Information Program, and that's a mouthful, so we just call it OSHIP. There's a 1-800, and I know Beth is also a volunteer and counselor for OSHIP as well. Usually in every, I can say, at least in the Columbus area, Franklin County, and the surrounding counties, there are volunteers in every county that work through the senior centers usually, or some just work through COAAA, or some work through like National Church Residents. They might be just a building manager at those sites. And a lot of people are volunteers for the Ohio Department of Insurance. But that 800 number, you can also contact them. And if you want to meet one-on-one with a counselor, we are now back to meeting face-to-face, which is wonderful this year. You can meet face-to-face with a counselor. You can meet them over the phone. You can meet them on a video chat. And you can even talk to, when you call the 800 number, there are counselors downtown that's their full-time job, is to talk to people and help them through matters of Medicare and Medicaid. We're trained initially for a long period of certain amount of hours. And then every year we have training and video training to enhance our knowledge on what's happening in the world of insurance for older adults. These can be issues that people that are new to Medicare, Medicare supplemental plans, drug plans, Medicare Advantage plans. There's another booklet that's free through the Ohio Department of Insurance, and I would encourage everyone who is going to be new to Medicare or already on Medicare, because things change. As you know, you read in the paper all the time how Medicare is going to change. This can give you updated information. The Medicare website also is a great resource for information on updated items. And especially this time of year where we have from October 15th to December 7th, where you have sign-up time. You're going to be hearing a lot about that coming up in the coming months as well, where you're able to change your Part D plans, your Advantage plans. It's always a good idea toward the end of the year to take a look at all of that to make sure you're getting the best bang for your buck when you're looking at your insurance. I always tell new retirees that, yeah, you're retiring from one job, but you just got a new job, and that's called Medicare. Because the health insurance, it's costly, and you want to make sure that you've picked the right plan for you and that's going to work for you from now and forever. But these plans change every year, so it's not a one and done anymore. It used to be, but it's not anymore. So, and the other thing is, a lot of people are working past age 65. And you need to know, what do I need to do? Should I sign up for any part of Medicare, even though I'm working and taking my employer's health plan? There's ways to do it efficiently and to make sure that you're in compliance with Medicare, because there are penalties if you don't do it properly. So the Ohio Department of Insurance and a counselor and this book can help you know what those might be and how you really want to access that information. Like I said, you can call the 800 number, talk to a counselor there, or ask for a counselor to meet face-to-face, because everybody's situation is different. Even if you think you're one of them, I have a straightforward thing. Well, it may not be that. There's a lot of kind of hidden things in signing up for Medicare, especially initially. A couple that I would mention is, if you're contributing to an HSA and you're thinking of retiring within the next year, if you continue to contribute to that HSA, you can be penalized through, it can be an extra percentage of tax on that money if you don't stop contributing 6 months before you join Medicare. Most people don't know that. If your income is above a certain threshold level, your premiums may be higher than what the norm is, depending on how much your income is going to be. And most people don't know that. So your premiums for Part B and Part D could be higher, and it's based on your income. So people that maybe are taking a bonus, maybe they have, selling a business, that type of thing, where their income is really large as they're retiring, they need to look at that. The other thing is, people already on Medicare, that maybe have been on Medicare a couple of years, and maybe they decide to give a gift. They're gifting some money to a child to buy a new house or whatever it might be, and they take money out of their savings or their investment accounts. That counts as income, and obviously that goes on their IRS statement at the end of the year. And just because they pulled that money, it could put them over that income threshold, even though their income doesn't come in at that threshold because they pulled that money. They may be then for 2 years have to look at pay a higher premium for Part B and Part D. So it's something to know ahead of time and educate yourself. And those nuances aren't always in the book, or, unless you're reading, those big, thick, yearly Medicare books that you get, and who reads those cover to cover? Nobody. It's a really good thing to check in with a counselor or call the Department of Insurance. The other number that I put on here was Pro Seniors, which is kind of the watchdog in Ohio for Medicare fraud and waste. You get a lot of stuff from Medicare in the mail. There's a reason for that. They can't call you. You think, oh, nobody. And if they do call you, you should report them to the Attorney General or call OSHIP and report them. Get their names, where they're calling from, because they're not allowed to contact you by phone or knock on your door unless you contact them first. And that's the law, and has been for a while. And most agencies know that. So just be aware that they're not allowed to contact you unless you contact them first. And also be aware, don't call a whole bunch of people to get information, because then they're allowed to continue to call you over and over and over again. Have your ducks in a row before you start calling around, and be careful who you call, because all these people can call and offer you anything, and just be aware of that. One of the other things I want to mention is the Medicare Advantage plans. There's a lot of information coming out on TV with Joe Namath. I'm pulling him, but they're talking about the Medicare Advantage plans, and certainly they do have a lot of pluses to their plans. But just because Joe tells you that you can get a caregiver in your home and meals delivered and all of that, don't take that at face value. You really have to look at each individual plan and how to qualify it, because most of those plans, out of all that laundry list of wonderful services that he mentions, unfortunately, most plans limit you to 2. Some plans limit you have to have a hospitalization in order to get the meals, and they only are 3 days after you come home, which is a great thing if you're recovering from a hospitalization. But there's limits on these and qualifications that you have to meet before you can tap into that. So the Advantage plans are a little more flexible and give you a little more services, but it's buyer beware, because you can't always count on those blanketly. Oh, I can get a caregiver paid for through my Medicare Advantage plan. Well, maybe you can, but you have to be able to qualify, and there's going to be limits on how much you can have. So before you tap into that, the other biggie is when you're turning 65, you have a one-time shot that they don't look at your medical. You don't have to be approved medically. So if you take on an Advantage plan when you first turn 65, that's fine. That's your choice. But maybe down the road in 10 years, you have maybe a little more of a catastrophic illness where it becomes hard to manage that, because typically the Advantage plans have lower premiums up front, but you pay as you use this plan. So if you get sick, you start to use the plan more, and you have a lot of co-pays on the backside, which is fine. It could be more cost effective for you even down the road. But just know, if that becomes ineffective and you find out you're paying more that way than switching to a supplemental plan where you have a set amount every month and then you have little co-pays on the backside, people who want to switch after you've already initially taken the Advantage plans, those supplemental plans are underwritten, so they can either deny you or bring you on with a waiting period or bring you on at a much higher premium. So beware of that as well. And that's another nuance that you might miss if you're just signing up on your own. So talking to an OSHIP counselor, either at the 800 number or in person, can really help out in those situations. Another great local agency is the 211. It used to be called Hands on Columbus. It still kind of is, but all you need to do is pick up the phone, dial 211, and you can get information over the phone on agencies for any community resource, food pantry locations, financial assistance, support services, caregiver support, whatever it might be. It's a huge database that's really been made more efficient. And it's the 211. It's like calling 911, only you call 211 and say, hey, my mother needs this, I need this, my neighbor, I thought I'd call for them to get some help there, and they can give you information. They also have a website as well. And a lot of it will be repeated information from this older adult resource book, but definitely it's another avenue to call if people don't have that or you need it quick. So don't forget about the 211 to call for resources as well. Again, you can give that information to the person, but if the person doesn't want to accept it, you've done all you can. Life Care Alliance is another, provides the Meals on Wheels in Franklin County and other services as well. And I have included their number here. I also included Social Security's number because for Medicare and things like that, you have to use Social Security first to sign up for Medicare. And it's always good to have their number handy as well. Right now, the Social Security offices are not open to the public, where we used to be able to walk in, take a number and sit and wait and see a counselor. They're working, the counselors are working in the office, but it's by appointment only. And most of the time you have to call to get information first or to set up those appointments. So I know here in County, the office that's over on Wilson Bridge Road, you have to make appointments to see counselors over there. The other resources is that I don't want people to forget about is the diagnosis-based, like the Alzheimer's Association, the Parkinson's Association, the MS Society. Those can all be helpful to people with that diagnosis. For support groups, sometimes they have lending closets for equipment. It could, for any of their needs. And just because if you don't want to, they have newsletters that can tell you, where their programs are being held, updates on advances in medication for those types of diagnoses, all of that. Don't forget about those. Most of those associations are in this booklet. So I would strongly encourage, going back to the first page of this, to get the Older Adult Resource Guide, because it's really inclusive of all the agencies and how to contact them and what they provide. So that's the presentation, kind of in a nutshell, and I hope it was helpful and gave you some tools in hand and phone numbers to call and contact, and how to use these agencies and how to contact them for the services that people need.
Thank you so much, Marcia. I do have a question for you.
Sure.
I find it very interesting, and I think it's a wonderful point to make, that people, once they call that number, the 1-800 number for the Medicare Advantage programs, then they have the right to call you back, and you've opened up that gateway for them to push their services. Is that correct?
Yes.
Okay. And so then would it be advantageous to, when you're talking to someone who's an OSHIP volunteer or representative or someone with a government agency, it's good to get their name, and then maybe do they have an ID number, or how do they identify themselves, or how do you kind of protect that gateway, I guess?
You mean the counselors themselves?
Yes. Mm-hmm.
Most of them are associated with the, we don't carry ID per se, but most of them, you can certainly call that 800 number because they have a record of all the counselors that are valid in Franklin County. Well, in all the counties, surrounding counties. You know, I counsel in Delaware County because I live in Dublin and it's both counties. So that 800 number, I think, would be the best way to vet that. Because if you're unsure, someone tells you that they're a counselor for the Ohio Department of Insurance, you know, take their name and you can call that 800 number just to make sure before you meet with them, because you are giving them, you know, personal information. You want to make sure. Most of the counselors work in, you know, the senior centers and have for years, but you definitely can call that 800 number and make sure that they are truly a counselor for the Ohio Department of Insurance.
Great. Bill, did you have any questions?
No, I was just going to say, based on what you just mentioned, it might be a good idea for either the senior, but also for caregivers, family members that are helping a senior. You can get at the dollar store, maybe for $1, a little notebook, spiral notebook, and maybe write down like the date and the time and the person you talk to at these agencies. That way, you know, again, even if it's $1, but it's all in one location. If you're like me, you have scraps of paper sometimes and you wrote something here and you wrote something there, but that way, you know, you would have a good record of who you've encountered, who you talked to, and, you know, so that was just an idea I had. One other thing, this was a very good presentation on getting referral information and referrals, very helpful. I just wanted to put a plug in for a couple things. One is, if you have problems with a service or an agency, I used to be an ombudsman, so the ombudsman program, which in this area is through Easter Seals, I think over in Hilliard, they can help with either skilled facility, assisted living, or in-home services. But the other thing would be, if you have a problem with a government agency, Social Security, the veterans, something like that, you're not getting satisfaction. I used to work for a couple public officials, so you can call either your U.S. Senator's office, they both have offices here in Columbus, or your local congressman, or if it's a state matter, it could be your state representative or state senator. And, you know, what they basically do is they get your complaint or whatever your problem is. If the agency gets a letter from them, it's going to like elevate it to the top of the pile. So, you know, you get more attention that way.
It's great information.
Great. Well, it's so wonderful that we have these resources. So I hope that people will take advantage of getting those resource books. And we're just so very blessed. I think Ohio is very proactive in getting resources into the hands that need them. So
I would agree.
Thank you.
You're welcome.
So much. Appreciate this. Again, this will be archived on the Forever Dublin Hub. And I always just want to promote the next event. We do have our plant swap on October 1st. So those of you in the community that are interested in that. So thank you again, Marcia. And I'm so glad that you are still at the Dublin Rec Center then. Is that correct? In person?
Yes.
And you'll be there starting October 15th through December 7th is the open enrollment.
And even now, we're counseling there, or Stacy or Wanda will take your name and give them to me, and I can contact you by phone.
Great. Well, thank you so much for your time and the presentation. And thank you, Bill, for joining us.
Thank you.
Have a super day.
You too.
Okay. Bye-bye.
Bye-bye.